All right, so you run a weight loss business in your practice and you have a patient come in and object to your pricing or the price of the medications. How should you respond? That's what we're going to talk about today. So I'll get that all the time. Patients will come in, I'll offer them a treatment in weight loss or any other kind of field, and they'll go, you know what? That doesn't sound like a good deal to me. It's too expensive. I can't afford it. What should you do? So let's use weight management as an example. These GLP-1 medications are not inexpensive. Sometimes it could cost $200 to $500 a month to be in a weight loss program where people can lose weight, and they'll be like, I don't want to pay $400 or $500 a month for your treatment. What can you do? I highlight, if money is the issue, I'll highlight the money they can save by spending that money. So what do I mean by that? Walmart did a study recently that shows that people on GLP-1s are buying food differently. They're choosing healthier options, and they're often not doing the processed stuff anymore. And processed food can be incredibly expensive. You're paying somebody to process this food versus whole foods are relatively inexpensive. And you can highlight, hey, your tastes are going to change. You're not going to have those cravings for, the frozen pizza in the food aisle. You're going to want fresh food, fresh ingredients. And because we're suppressing your appetite and your cravings, you're going to make healthier decisions, and you're going to choose cheaper options. And your grocery bill could be offset by several $100s a month just by you not eating as much crappy food, and buying healthier food. The other thing that happens is we are in a fast food culture. I could do this all the time. Like, I'm busy, I forget to bring my lunch to work. What do? I go across the street to the fast food restaurant and I eat crap. Guess what? If you're on a GLP-1, you're not going to do that. Think about how much money you spend a month on just fast food and eating out. For most Americans, it's several $100s. Without an appetite, you're not going to do that. So you could just say, hey, I'm going to lower your fast food budget. I'm going to lower your food budget. I'm going to decrease the amount of money you spend in other areas so you can pursue this. And then once we're done with this therapy, you can stop spending that and you'll still have all these good habits for the rest of your life. So that's one way. Another way, oftentimes people will be on diabetic medication. They'll be on all these different meds because of all these chronic conditions related to their metabolic syndrome, their overweight, their obesity. Guess what? When they get healthy and they lose all the weight, you're not going to need that insulin anymore. You're not going to need that, metformin, perhaps. You're going to get them off of diabetes type 2. And think about how much money that's going to save them in co-pays and whatnot. So a short period of, yes, extra budget, extra money is going to result in long-term savings. So, and that's just a couple of examples. You can come up with a whole bunch of more ways that they can save money by spending a little bit now. So talk about it as an investment, not a cost. You're investing in your future. You're investing in your health. You're going to save money in the future. So change the tide from cost to savings to value, and you'll be on the right track.